Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Jim Sholler. He is a consultant and he's author of the book Solved in Seven: The Power of Disciplined Problem Solving. His Kevin MD article is titled Patient Care is Not a Spectator Sport. Jim, welcome to the show.
Excellent. Thank you, Kevin. Thanks for having me. I really appreciate it.
So we'll get into your book and article in a little bit, but first off, just share your story and journey to where you are today.
You bet. So I spent about the last 27 years with Fidelity Investments. Definitely not your typical medical background. It was more of managing different problems and trying to find resolutions for groups that were struggling to either perform operationally or deliver software, many different disciplines across Fidelity Investments. And my brand for most of the 27 years was the fixer. So again, I was brought in, if things weren't running well, I was brought in to get them back up and running efficiently again. And that helped me over this 27 years to really kind of refine my approach, which is unlike most problem-solving approaches, it's a leadership-based approach where, I wasn't the expert in most of these areas. My expertise was being a problem-solving leader and pulling the experts together to resolve problems.
So how did you get involved in the healthcare space?
So interestingly, when this was kind of my secret power, my superpower at Fidelity, I never thought of this as something that applied anywhere else outside my job. To me, it was just my secret trick to help me be successful at work. Unfortunately, in my personal life, in parallel to many of those years, about 13 years, we were researching a very rare bleeding disorder that my wife was experiencing. And we were with the best doctors from New York City to Boston. And we spent about 13 years, well over $1 million in medical costs. Her right arm is permanently disfigured from a skin graft. She flatlined from a plasma transfusion. And during those 13 years, we learned a lot, became experts in bleeding disorders, and ultimately realized that there is a lack of problem-solving expertise. There's diagnostic abilities, but there's a lack of problem-solving skills. And when we finally applied what I used, when it finally occurred to me to use what I do at work every day to this problem, we reached a diagnosis the correct diagnosis within 7 minutes of the exercise. And that's when it really kind of turned things around for me, that it is a sorely needed process, not just a trick I use at work.
So let's go more into that. You talk about in that Kevin MD article titled Patient Care is Not a Spectator Sport. Now, for those of you who get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Absolutely. I was fortunate to take a voluntary buyout from Fidelity about a year ago. And my passion for this activity was turned into writing a book. And as I researched the book, I started out looking at misdiagnosis and how often does misdiagnosis happen. And knowing nothing about this space, I was shocked to learn from a Healthline article by Brian Mastriani that upwards of 40 to 80,000 people die from complications due to misdiagnosis every year. And I had to go for a walk when I read that. That just was complete shocking to me. Mm-hmm. So what I really wanted to get across in the article was the importance of understanding if in the vacuum of no practiced diagnosis or problem-solving analytical skills, what happens? And what you see, what I've noticed over the years is there's 4 bad behaviors or bad practices that happen. It's, you get stuck in a problem, you get stuck in a theory, you implement workarounds, and sometimes workarounds like using, prednisone to treat inflammation. That's absolutely necessary. The problem with the workaround is then it works, so no one follows up on what was the underlying problem. And that's what happened in my wife's case is, the first time 13 years prior that we had the episode, they treated it with prednisone, said, oh, look, swelling went down, bleeding went down, she seems okay, until it came back. So that's, workarounds are dangerous because if no one keeps researching, then you're in trouble. And finally, the last bad behavior is blame. When no one has full accountability for their space, they don't think that the problem falls into their area of specialty, the finger pointing starts. And that could be at other specialists that they should have seen something, or that the patient's doing something. In our case, we were ultimately actually accused of causing my wife to bleed ourselves. So blame had fully kicked in. So really, as I put kind of all these pieces together, I thought, I have to write about this. I have to empower people to understand that, as much as, and I know you've had other podcasts about the importance of the patient in providing information, and that's absolutely critical, but even that's not necessarily enough. I realized we had to do more than just provide everything we knew. So you really realize how important it is to play a leadership role in the diagnosis of a challenging problem. And if someone's not doing that, then you step up and do that. And that's what I'm trying to inspire, whether it be physicians, nurse practitioners, or patients themselves, to understand how important it is to be a leader and bring the experts together. I'm not a medical expert, and yet it was the leadership that was required to help us get to the proper diagnosis. So that's really the point of the article, is to just hit home and hopefully inspire people to become leaders in the diagnosis of challenging problems.
So give us an example story or case study, and I know that you shared a little bit of that really illustrates some of the problems that you're talking about in healthcare. What would that look like in real life?
So a lot of what you're seeing now, common misdiagnoses, for instance, in the space of ADHD, dyslexia. So for instance, my daughter, and there's a story in the book about this, but my daughter is severe ADHD and severe dyslexia. She actually has a specific form of dyslexia, which causes the letters to look like they're vibrating and bouncing around for her. And as a child, she didn't know how to explain that. And you don't know that, this isn't what everyone sees. So she went through all of the typical, the bad behaviors. She's probably not, doing the homework. She's probably not trying hard enough. The blame, she's lazy. And we went through, and we're not the first ones to go through this. It's so common, especially in the dyslexia space. It's just so common to have those behaviors rear their ugly head. And it wasn't until the leadership role, we realized again that there had to be a leadership role in this, and start to walk through, what are the facts? What are the questions? Let's take the emotions out of this. And what you learn also a lot of times is you can say the same things, ask the same questions. Have you tested for this? Have you tested for that? When they come across in an aggressive manner, they're not heard. They're just not received the way you want them to be received. When you put a framework and a process around it, and it's just one of 5 questions that has to be answered, you're more likely to actually get to the facts that you're looking for. Dyslexia is a tough one because there really is no physiological test to see that you have it as of yet, at least that I'm aware of. So it's incumbent upon the patients, the parents, the child, to really do the proper research, get the right experts involved, do the right testing, and just learn the facts. Ask the right questions and learn the facts. And that's one example we've seen where it's just, don't accept the bad behaviors, keep pushing.
So from the patient point of view, what are some specific things that they can do to take more of a leadership role and implement some of your ideas in practice?
So I think it's key to become, one of the most important things is discipline. There's a myriad of problems resolution practices that are out there. The issue is actually being disciplined about using them. So in my wife's case, she was phenomenally disciplined about recording every fact, everything that happened. And that's the most important thing, is don't fly by the seat of your pants. Don't, run in ready to fire off 5 questions off the top of your head in an emotional manner. What's important is document the facts, document the questions, and think about it as a learning process. You're not trying to prove a diagnosis. You're not trying to guess a diagnosis. You're trying to learn the diagnosis. So you document the facts, document the questions, and you just keep cycling through those, the questions. New facts will bring up new questions, and you just keep cycling through. So I think that's the number one thing, is to just be disciplined about writing everything down. And facts can be the day of the week, the temperature outside. It could be anything. You just never know what's going to be an important fact. But the documentation is critical to supporting the problem solving process.
You're also the author of the book, Solved in Seven, The Power of Disciplined Problem Solving. So, what are some of the key points that you want readers to come away with after reading your book?
I'm hoping that readers come away feeling empowered and inspired to play this role. It is not, even the title can sound intimidating. Like, this is something that, I use at work, well, I'm retired. That doesn't apply to me. Well, it applies. And that's what I've tried to do in the book, is go through professional examples, personal examples, and medical examples. And what I'm hoping is people are inspired to say, this seems pretty easy. This really isn't, as I like to say, connecting the dots is easy. The hard part is inspiring leaders to identify the right dots. And that's hopefully what people will take away from this, is that they're compelled and inspired. That's one thing I learned early on, is you go in a corporate career, you go to a lot of different trainings. The only ones that stick are the ones that had a compelling story behind it. So that's, I've tried to put a simple framework in place with very compelling stories.
We're talking to Jim Sholler. He is a consultant. He is the author of the book, Solved in Seven, The Power of Disciplined Problem Solving. His Kevin MD article is Patient Care is Not a Spectator Sport. Jim, for the clinicians listening to you on this podcast, what are some lessons that they can take away from what you're talking about?
So again, I think the discipline to use a process, but also not, if you read the book, you have to move from the fear of being a leader. It's easy to refer people, to send people to the right expert, because I don't know that space. And for me, maybe I'm a little more comfortable with it because I've always been thrown into the deep end when I didn't know how to swim. And for some reason, I'm okay with that. I'm comfortable with it. I think that's the hard part for a lot of people, is being comfortable pulling in specialists, experts in areas that you know nothing about. But what you become comfortable with is that your expertise is being a problem-solving leader, pulling people together. One of the key steps is actually educating people on the process. And once they understand the process, they'll participate, they'll become followers, you're the leader, and you'll be amazed how much you learn through the whole process. You learn. I mean, I know so much about factor 13, hemophilia deficiencies and all kinds of weird genetic disorders that I would have never known anything about if I didn't go down this process.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
So one thing is that I'm trying to work on to support this is an app that would hopefully provide a platform to do this. And I say that I'm certainly not marketing it because I'm way at the early stages, but it's to really undermine the importance of being disciplined about using it. Just, it doesn't have to be my methodology. Pick a methodology, but be disciplined about using it. And you'd be amazed, start with something simple, and I have people ask me all the time, well, what if people don't want to participate in your process? They don't want to hear you. I think the best way around that is to start with a problem that is your problem and pull experts in to help you. People usually like to help someone else. They like to give advice. They like to help. Once they see the benefit of what you're doing, they're more likely to ask you to come do that. I had often at work, people would say, we need you to do that thing you do. And when you get to the point where people are saying, do that thing you do, then you've established yourself as a problem-solving leader. So I think that's the most important thing, is just not to be afraid of becoming a leader in this space and pulling the experts in. You'll learn from them.
Jim, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks, Kevin. I appreciate it. Thanks for having me.